Hello, my name is Temitope Banjo. In this video, I'm demonstrating medication and injection preparation, and I have the physician order and medication record, which I'm going to be comparing in order to validate disease right, which is the right to patient, right to medication, right to dose, right to time, right to route, and right to documentation. I'll be looking at the physician order and medication record to see if the information in the medication record is right with what we have in the physician order. Name of patient Buzaja, correct. MRN number 8734651, correct. Date of birth 06/2019, correct, rightly stated. Allen Long, MD, correct and rightly stated. For the date --2020, time 7 a.m. Physician order says the first medication, ceftriaxone 1 gram, high MQ 12 hours for infection, reconstituting 2.5 ml sterile water. Medication record says ceftriaxone 1 gram, high MQ 12 for infection, reconstituting 2.5 ml sterile water, 7 a.m. And the second medication says --2020, 7 a.m. PPD 0.1 ml, ID today, reading 48 to 72 hours. And the medication record, it says PPD 0.1 ml, ID today, reading 48 to 72 hours at 7 o'clock. The third medication says --2020, 7 a.m. NPH insulin 12 units sub-Q before breakfast. And it says in the medication record, NPH insulin 12 units sub-Q before breakfast 7 a.m. sliding scale, regular insulin sub-Q, AC and HC. From what I see here, the information in medication record tallies and it's correctly stated from the physician order. For the medication record, it says no allergy, physician order no allergy. For my patient Buzaja, her glucose level is 389. She falls in the group of 351 to 400 blood sugar group, which means she's going to be taking 12 units insulin, and that is what we have in the order. So this done, I'm going to be doing 3 checks in this video. I'll be moving ahead to my first check by taking my medication from the cart, second check preparing medication, and third check which is going to be to confirm the medication in the patient's room. Now, starting with my first check, I'll perform hand hygiene. I'm going to be in a new glove using the information. I have number 1 medication, ceftriaxone 1 gram, IMQ 12 hours for infection. In the drawer, I'll look for ceftriaxone. Here is ceftriaxone injection powder, and the dosage I have here is 1 gram. No need of measurement. I'll be able to see what I want. It says reconstituting 2.5 ml sterile water, and I have sterile water here in the drawer. I pull it out. To administer this, I'm going to need syringe and needle. I'll be using 3 ml syringe, and I'll need to use 2 needles, which I'm going to set aside. Then for the PPD, for the sake of this video, I'm going to pretend this is a PPD. I don't have a PPD. I'll use my bacterial water for my PPD, and I'm going to use a tuberculin syringe to administer the PPD. For the next medication, I have NPH insulin. I'm going to bring that out from the drawer, NPH insulin. Then I have sliding scale regular insulin from the drawer. I'll bring that out. Then I'm going to administer that with insulin syringe. So I'm going to confirm what I have: ceftriaxone, sterile water, needle and syringe, PPD, tuberculin syringe, NPH and regular insulin syringe. So I've been able to pull the correct medication, and to confirm the dosage, I'm going to be going to the nursing drug reference book, looking for the medication and the dosage and the usage in the book and side effect. Here I have ceftriaxone. It belongs to the class of cephalosporin. For an adult, it says for high hem, between 1 to 2 grams per day. And here you go, I have 2.5 ml ceftriaxone 1 gram, 1 gram, high hem, Q 12 hours. That means we are within range. The order is within range for the patient, since it's between 1 to 2 grams per day, and we are going to give 1 gram under 12 hours, which is fine. The action is it inhibits bacterial cell wall synthesis, and it is used to cure an infection. And from what we have here, it says for infection, which means it's right. 1. What are the things to watch out for after administering ceftriaxone? Side effects includes headache, dizziness, and seizure. So that the things we watch out for. For the PPD is an intradermal injection that is administered to test the presence of tuberculosis in the body system, and it says it should be read under 48 to 72 hours, and from the record it says be read in 48 to 72 hours. Then for the insulin, it says insulin regular 30, it should be administered 30 minutes to 1 hour before meals, and for the MPH individual between 7 to 12. For what we have here, it says it should be administered before breakfast at 7 a.m. So I'm going to tell my patient, if there's any tray for you, please keep it aside until we are done with the injection. And it's not going to be immediate, just be with a little time within 30 minutes to 1 hour, then the patient will be able to eat. Then it says action is to decrease blood glucose. From what we said earlier, that her blood glucose level is 389, and she's going to be taking 12 units. That is to suppress the high rise in the glucose level. Then we have side effects. We have blood vision and dry mouth. Those are the things to watch out for after administering the insulin. So I've been able to complete my first check, and I'll be moving to the second check, which is preparation of my medication. And to do that, I'm going to perform hand hygiene and I'm going to be putting on a clean glove. Now, to start, I have ceftriaxone going through the method, and I have sterile water. I'm going to take my syringe and I'm going to prepare. I'm going to fix a needle. I'm going to drop this in trash. Just trying to take off the cap. So it says reconstitute in 2.5 ml sterile water. I'm going to put this on the cat, and I will get an alcohol pad, and I'm going to wipe the cap of the valve. Now wipe this one too. So down, I'm going to take off the cap. The needle should always go this way, and I'm going to draw 2.5 ml of air into So I've been able to draw 2.5 ml of air. This air I'm going to drop into the sterile water, and immediately I'm going to draw 2.5 ml of sterile water. I've been able to draw 2.5 ml of sterile water. So I'm going to keep that here by taking the ceftriaxone. I'm going to wipe again. So I'm going to drop the hair straight into the So I've been able to drop the hair into the ceftriaxone. So I'm going to take out my needle, and I'm going to provide safety by scooping. Don't forget, yes, provide safety by scooping. I'm going to scoop. put this here. Then I'm going to make sure I mix the water with the powder. I will rub it in my palm, and I will not shake. The instruction says do not shake, but I can mix it so that the one by the side will mix. Everything is evenly mixed now. I've been able to mix it. I'm going to sit the vial down, and I'm going to wipe again. Then I'm going to take off the cap of the needle, and I'm going to be drawing 2.5 ml of air into my, I'm going to be drawing 2.5 ml of air into my ceftriaxone. And I will draw the 1 gram required that we're going to administer for the patient. I'm going to draw that completely. Good. I was trying to make sure I withdraw completely the total 1 gram. I have been able to withdraw the total 1 gram, and there's nothing left in the bottle. So I'm going to put it down, and the next thing is I'm going to change the needle because I'm not going to use this to administer it. I'm going to scoop. I'll take off this needle, put it in sharp object container, and I'll be fixing a clean needle. So I've been able to draw and put a clean needle. So I have this here with the, just to set it aside. The next thing is to draw my PPD. I'm going to clean with an alcohol pad again. Then I'm going to take off the cap carefully. Going by instruction, it says PPD should be 0.1 ml. So I'm going to draw 0.1 ml of air into the syringe, and I'm going to drop the air into my so I'm going to be drawing 0.1 ml of PPD right here. .1 ml. So I'm going to put this air And I'm going to be providing safety again by scooping. Then the next medication is NPH insulin and the regular insulin. I'll take off. Then I'll be using another alcohol pad to clean the top of the valve. But before I clean, I have a cloudy insulin. I'm going to roll that in my hand. I'm going to roll that. As I roll that, I'm going to now clean the top of the valve. After cleaning, I'm going to take off the cap and I'm going to draw 12 units of air into my syringe, and I'll drop the air into the NPH. I will draw the needle. I'll draw another 12 units of air. I'll draw 12 units of air. I'll drop it into the regular, and straight away I'm going to draw 12 units of I've been able to draw 12 units of regular insulin. I'll be showing this to a RN. Then I'm going to be drawing another 12 units. I have to be careful. I already have the 12 units, so I'm just going to be careful. So I'm going to make sure I draw another 12 units. So I've been able to draw another 12 units, and I'm going to show another RN. So this one, I'm going to perform safety again, provide safety by scooping. I've been able to scoop, and I want to verify ceftriaxone. There is 1 gram of ceftriaxone. I have PPD 0.1 ml. I have the NPH insulin and the regular insulin, which is 24 altogether. Now I'm ready to go to the patient's room to perform the third check. I'm going to take off my hand glove, perform hand hygiene, and I'm going to put on a new glove. Now I'm in the patient's room. Hello, how are you? My name is Temi. I am a student nurse from Mountain View College. I'm here today to administer your injection. Is that okay by you? Can you please verify your first and last name for me? Boozer Jack. Date of birth 06/20/19 -- Thank you, Miss Jack. Looking at her wrist. So the next thing I'll do is, Miss Jack, allow me one moment to please verify my medication. So with what I have ceftriaxone 1 gram, which is what I have here. I have the PPD 0.1 ml, right? And I have the NPH insulin 12 units of Q, and sliding scale regular insulin sub Q AC. I have 24 altogether, 12 units of each. So I have my correct medication, and I'll be able to confirm the name of the patient, and everything is right. So the next thing I'll be doing is I'm going to adjust the bed to working height. I'm going to put down the rails, and I'm going to let her know how we are administering 3 injections. And for the insulin, it should be administered 5 minutes, within 5 minutes of preparation. That's why it happens to be the medication I prepare last. And in doing this, I'm going to perform hand hygiene, and I'll be done in a new glove, because I'll have taken off the glove I have on me. Then I'll be locating the site where I'll be inserting my injection. But to administer these 3 injections, I'll be starting with the least painful to the most painful. So the first injection I'll be administering is the intradermal injection, which is the PPD. So I'll be going into the anterior forearm, using 2 to 4 fingers below the accubitus, and it's going to be one width above the wrist. So it's going to be within here. I'll be make sure that the needle is visible in the skin when I'm inserting. So now I'm going to already said it, but I just want to put it on. Like, I have my glove on. So here is my patient. I'm going to take the cap off of my injection. Now I'll be making sure that I wipe. I have enough here, so I'll wipe with the alcohol pad. I'll wipe, and I'm going to administer my injection, making sure the skin is visible. I'll be going this way. So I've been able to go within 5 to 15 degrees into the skin, and the needle is visible while I was administering the injection. I'll be able to administer the PPD, and I'm going to cover this and put this in the sharp object container. The next thing is I'm going to perform hand hygiene again, and I'll be done in a new glove. So I'm going to clean the residual area in a circular form. Then I'll be going to the next injection, which is going to be my subcutaneous injection. For this, I'll be going 45 degrees into the skin, but I'll first locate the site. And for this patient, she has chosen a stomach. If this side has been used before, I'll be moving to the other side. Then I'll let my patient know that I'm going to pinch her skin, and before I administer, and right here for the abdomen, I'm going to go this way, pinch. There you go. And I'm going to take out the plunger, and I'll put this in trash. Then for the last injection, which is intramuscular, I'm going to tell my patient I'm going to be administering that in a fleshy part, which is the fascia lateralis. I'm going to be using my hand to hold some flesh, so that when I finish administering, the other flesh will be left to cover the other part. So I'll be going in 90 degrees and in a zigzag direction. So I'm going to take off the cap, and I'll use my hand to take the flesh this way. So I've been able to administer the injection, and I'm going to, before I do that, I think I should have cleaned, but I'll clean it. In case there is a blood, I will make sure I clean very well. I'll put gauze, so I will have cleaned before I administer the last injection too, and I'll make sure I perform hand hygiene before I do that. Since I already have my glove on, I just must mention it. I must perform hand hygiene and do the necessary thing. So after administering the injection, I'll clean. Then I'm going to take off my hand glove, perform hand hygiene, because I'm going to be demonstrating my ampoule. And for the ampoule, I already have a new glove on. I'm going to make sure I do it this way, make sure everything comes down. I beat it this way. Then I'll get an alcohol pad to hold the tip, and I'll take it away from me and from my patient, and I'll break. So I'll put this one in trash, and I'll be using a filter needle in case there will be some particles in it. So that's the end of my video.